So let's start with the next section, and we're going to talk about the tissues of the immune system and what they consist of. Remember that the central lymphoid organs and the peripheral lymphoid organs are what make up the tissues of the immune system. So what are the central lymphoid organs? The central lymphoid organs are the thymus and bone marrow. Remember that here the T and B lymphocytes mature and become competent to respond to antigens. What are the peripheral or secondary lymphoid organs? The secondary lymphoid organs are the lymph nodes and spleen and mucosal associated lymphoid tissue, or MALT. Remember that it is here where the adaptive immune responses are initiated. These organs optimize the interaction between lymphocytes, antigen presenting cells or APCs, and antigen. So talking about the lymphoid organs, remember that the generative lymphoid organs are in the bone marrow and thymus. B lymphocytes are in the bone marrow, and T lymphocytes are in the lineage. We're talking about where they mature. And then talking about the peripheral lymphoid organs, these are the lymph nodes, spleen, and mucosal and cutaneous lymphoid tissues. Remember that following the production of lymphoid progenitors from the bone marrow stem cells, functionally mature B cells are generated in the bone marrow, while functionally mature T cells are generated in the thymus. What happens to immature lymphocytes generated in hematopoiesis? These lymphocytes generated in hematopoiesis mature and become committed to a particular antigen. What is the site of generation of all circulating blood cells in the adult, including immature lymphocytes? This is the bone marrow, and this is also the site of B cell maturation. What is the site of T cell maturation? The site of T cell maturation is the thymus. Here they are generated and selected for T cells, and it induces death of the thymocytes that do not mature correctly, and the thymus declines with age. Also remember that in the thymus we have the Hassel's bodies. What happens once mature lymphocytes have been generated in the primary lymphoid organs? Once the mature lymphocytes have been generated in the primary lymphoid organs, they circulate in the blood and lymphatic system. Describe the lymphatic system. The lymphatic system is a network of vessels that collect fluid that has escaped into the tissues from capillaries of the circulatory system. Describe what is contained in the lymph. The lymph contains a mixture of substances that are absorbed from the tissues. This could include debris from dying cells or antigens from infectious organisms. What are the two main secondary lymphoid organs? The two main secondary lymphoid organs are the lymph nodes and the spleen. Describe what happens in the lymph nodes. In the lymph nodes, this is where the adaptive immune response to lymph-borne protein antigens are initiated. Describe what happens in the spleen. The spleen is the major site of immune response to blood-borne antigens. So to summarize, remember that in the spleen we have the immune response to blood-borne antigens, but the lymph nodes are where the adaptive immune response to lymph-borne protein antigens is initiated. Now let's consider the anatomy of a lymph node. What are found in the primary lymphoid follicles? In the primary lymphoid follicles you would find B cells. This is the B cell zone. What are found in the paracortex? In the paracortex you would find T cells. This is the T cell zone. Also note that there are secondary follicles with germinal centers. When looking at the anatomy of the lymph node, remember that there are afferent lymphatic vessels, and this is where the antigen would enter, and also we have efferent lymphatic vessels. We also have one artery and one vein, and this is where the lymphocytes would enter. Now let's think about the anatomy of the spleen. When looking at the anatomy of the spleen, we must notice the red pulp and the T cell zone, which is the Powell's area. There is a central artery, and there is a germinal center and a marginal zone, and together these make up the B cell zone. What are carried into the spleen through the splenic artery? Blood-borne antigens and lymphocytes are carried into the spleen through the splenic artery. What are the two main compartments of the spleen? The two main compartments of the spleen are red pulp, which contain macrophages and red blood cells, and white pulp. So remember that macrophages and red blood cells are found in the red pulp. So now, as a review, remember what are the primary and secondary tissues of the immune system. The primary tissues of the immune system are the bone marrow and thymus. The secondary tissues of the immune system are the lymph nodes and spleen. Here is an MCQ. T cells mature in which of the following tissues? A. Spleen. B. Lymph node. C. Bone marrow. D. Thymus. Of course, the answer is the thymus. Next MCQ. Blood-borne antigens most commonly induce immune responses in which of the following tissues? A. Bone marrow. B. Spleen. C. Thymus. D. Lymph node. The answer is B. Spleen. What happens in asplenic people? In asplenic people, they are more susceptible to encapsulated bacteria. For example, and they also have difficulties with protozoa. And an example of bacteria they would have difficulty with. One example of the protozoa that someone with out of spleen would have difficulty with is Babesia